Okay, so the first observation was for a hospital follow up for a 43-year-old female who had just gotten out of the hospital a week prior. She initially went into the hospital for a bladder infection, which then turned into a kidney infection, which later entered the bloodstream, causing sepsis to set in and required her to be on a ventilator for an extended period of time. So this was a follow-up with her primary care doctor, who is in her 30s. Upon entering the exam room, it was like a typical exam room, pretty tiny. There was a sink, a stool for the doctor to sit on, chair for the patient, and an exam table. Very sterile, pretty typical area. Her initial concern, the patient's initial concern when entering the exam room was in regards to her foot pain. This was unrelated to her hospital visit, but a concern she had that had been previously brought up in other encounters with this physician. Okay, moving on. So there was several terminology that was used in this appointment, such as sepsis, shunt, intubation, ventilator, depo, HIPAA, inflammation, amongst others, but this was all related to her kidney infection that caused all of these issues. I personally do not know any of this patient's medical history, but she did come in for an initial bladder infection, which later resulted in all of these other issues. Her biggest concern was her kidney infection that caused other things such as vocal cord damage. She whispered the entire appointment and said that had been that way since her procedure because of the intubation tube. Um, because of this, the patient was speaking extremely quietly. And then she also went and laid down for the physical exam portion of the appointment, which may cause another paralinguistic demand that would be challenging to interpret. Not only being able to hear the patient, which was difficult, but then on top of that, her laying down, which is another demand here. The patient was given a stent when she went into the hospital initially, and it has been in for 3 months, and it has been experiencing some pain from that stent. The provider is not entirely sure why the stent is still in, so there were some concerns regarding that. The patient is still experiencing some pain from the procedure she just went through. She's very weak. It's really hard on her after working a full 8-hour day. She's exhausted and dizzy and just does not have a lot of energy. The patient goes back to her foot and saying how the arch had just dropped, making it very uncomfortable to walk. But it is only in one foot. The provider's biggest concern about this was that she would go ahead and refer her to a specialist in order to figure out if they need to get some arch supports, etc. But she had noticed that the patient was wearing just flat shoes and that would not help at all. And she made sure that the patient knew that the shoes she had on were not very conducive to her dropped arch, and she should make sure she has very supportive shoes on. The provider did notice that the patient's voice had increased some from the last time. She said the last time it really was a very faint whisper. So she noticed there was some improvement, but not a lot. patient has obviously had a lot of medical bills, so she has almost beat her deductible. So that was a big concern here for the patient. She wanted to get in any specialist she needed to go see before the new year. That way, she would not have to continue to pay out of pocket for these expenses. Also, another concern of the patient was that they had a trip planned. Her and her family had a trip planned for the weekend, but it required extensive travel, which she could not do in her condition and needed the provider to write a doctor's note. Again, the chief complaint here was her foot pain, her loss of voice, and possibly removal of the shunt. She is very concerned about how long her voice has been gone since the surgery, and that was one of her main concerns here. Overall, the patient seemed to be in a good mood for the most part. I mean, she did have several concerns, but wasn't per se freaking out or stressing too much about it. And the provider was really willing to work with this patient. She lined up different specialists to see regarding her foot, if she needs to go back and see the specialist regarding her shunt, etc. So she was willing to work with her. She kind of knew a lot of her background here with this. No direct miscommunication occurred here, but I guess in previous appointments, a provider had suggested that a sleep study be done on this patient. And the provider that I saw was not still under that impression, but supposedly that was no longer needed, and the patient informed the current provider about this. I think one of my biggest demands here was that the patient had a complicated medical history just from this initial hospital stay, the various doctors she had worked with, from the renal doctor to the other doctors involved, the OBGYN, because it started out as a bladder infection. All of these different doctors, different names would be said that I had no idea who this person was, who that person was. So it was kind of confusing at first for me to grasp, okay, so they were talking about her kidney doctor, but now they're mentioning a new name. I'm not sure who this person is. So that would be some background information that would be beneficial upon going in and actually interpreting this assignment to know who is who and how are they related to this entire appointment. Another issue, obviously, was the quietness of this patient's voice, that it would be difficult to hear and make sure I'm interpreting everything correctly because they are speaking so quietly. In regards to the medical terminology, some of the words are also difficult. I'm not entirely sure what depot meant in this regards, so that would be something I would need to further research and figure out how I would go about interpreting this. I mean, there are other things such as sepsis. Okay, I know what that is, but how am I going to convey this or sign this? So that would be some research that needed to be done here. Some controls I had before was kind of getting a little bit of background information from the provider. So when I went in, I was not completely lost as to what was going on. And I already had previous experience with kidney related terminology, as I have interpreted several dialysis appointments. So that was something that kind of helped going through this assignment. So that is all for my first observation.